Good morning, everybody. It's my great privilege to be able to introduce our keynote speaker, Governor Pat Quinn. He served as the 41st governor of the state of Illinois from 2009 to 2015. When he took office, he had three major crises going on: the ethics crisis in state government, the worst recession since the Great Depression, and a physical crisis in the state of Illinois. Needless to say, he hit the door running, and while he was in there, he restored the integrity of the state government and led passage of ethics reform and first-of-its-kind campaign finance reform in his first year. It's a lot of hard work there. Dedicated to investing in Illinois economy, Quinn worked with the General Assembly to pass a $31 billion capital construction job program to create and retain more than 436,000 jobs over 6 years. When in office, he made tough, responsible choices to ensure that the state of Illinois could afford to pay its bills. While in office, he also the Illinois unemployment rate was cut to its lowest point in more than 7 years. Pat Quinn is relentless in ensuring that all who need health care get it. Under his leadership, 670,000 people have health care coverage in Illinois that did not have it a year ago. He launched an innovative Birth to 5 initiative focused on 3 keys to a healthy child: prenatal care for all expecting mothers, access to early learning opportunities, and strong parent support. He increased access to healthy food by announcing that children in the Special Supplement Nutrition Program for Women, Infants, and Children, our WIC program, would receive an increase in the amount allotted for fruit and vegetables. He also passed a diabetes action plan into law. In addition to that, he supported legislation providing job protection for working pregnant women by requiring employers to make reasonable accommodations for full-time and part-time employees. He doubled the earned income tax credit to provide the largest amount of tax relief to working families in Illinois history, and it's committed to doubling it over the next 5 years. He fought for and signed a law amending the Equal Pay Act to give employees more time to address issues of underpayment and making Illinois equal pay policies consistent with the national Lilly-Ledbetter Fair Pay Act. He served the people of Illinois for more than 30 years, both as a citizen and a public official. He has organized grassroots petition drives signed by more than 4 million voters. He walked across the state in support of decent health care for all and proposed historic tax reform for working families. In the 1980s, he spearheaded the creation of the Citizens Utility Board. He was elected lieutenant governor in 2002 and reelected in 2006. Serving until his succession as governor in January 2009. And he served as the state treasurer from 1991 to 95. He also served as commissioner of the Cook County Board of Property Tax Appeal and as revenue director for the city of Chicago. As lieutenant governor, Quinn created the Illinois Military Family Relief Act, which provides financial assistance to family of Illinois National Guard members and reservists called to active duty. This fund has distributed more than $10 million to Illinois military families. And he graduated from the Northwestern University School of Law and Georgetown University School of Foreign Service. He's the father of 2 sons. Let's please give a good, warm welcome to Governor Quinn.
Well, thank you. It's an honor to be here, and welcome to Illinois. And I want to thank Kurt, who worked on my staff as a legislative liaison, for inviting me, and quite impressed by your organization and want to know more about it. And when Kurt called me, he said to talk a little bit about some of the work I did as governor, but also before that, how you organize and put movements together. And I do believe in movements. I think that's really what your organization, your association is. It's a grassroots movement of dedicated men and women who believe in a cause, and that's the most powerful force on earth. That's what Margaret Mead said a long time ago, that when thoughtful, committed people band together for a cause they believe in, there's nothing more powerful. And especially in our democracy, where we believe that the people are the boss of the politicians, sometimes folks scratch their heads and wonder if that really is true. We have to reinvigorate our democracy. We have to, especially I think at the local level, recharge those citizen skills that all of us need in order to make sure that those we elect truly represent us. And as you may have heard, I have not only been involved in being in government and organizing to try and get legislators to pass laws and so on, both at the federal level and at the local city level and state level. But I also believe in petition passing and putting referendums on the ballot. And many times that's the key way, at least, of bringing attention to an issue. And I've been involved in a number of referendum campaigns that have succeeded and changed laws and made it better for everyday people, particularly consumers. And I think it's very important to always keep that in mind when you're talking about advocacy, that sometimes legislators need a wake-up call, and one of the best ways to do it is people at the state or local level putting something on the ballot that gets their attention. But I would say my own experience, certainly with respect to health, was affected by my mother and family, my father and mother. My mother had diabetes. She lived to 98, and she just passed away last November. When she was born in 1917, in October, women didn't have the right to vote in America. The constitutional amendment came several years later in 1920. And when she passed away, late in 2015, quite a few things had changed in our democracy. My mother was witness to that, and she did believe in being active and participate and speaking out. And when she got type 2 diabetes, she paid attention to her educators and to her doctors and to her family. I think if you have a family history of diabetes, it's important in particular for family members to know that, to teach each other and to teach the community. And so I really commend everyone here for your mission. It is a mission, and it is so important that we understand that your great work is really a public health mission for all of us to partake in. You can lead us, but I think all of us need to participate. And I had also a person who influenced me on health was my doctor, and his name was Quentin Young. Again, he just passed away this year, a few days ago, and he was 92 or 3. And Dr. Young was, for all of his life, a very active person when it came to demanding decent health care for everyone. He believed in universal health care. He was always in the forefront of that battle, not only here in Illinois. He was the head of the Cook County Hospital for many years. He was a great doctor. He marched with Dr. Martin Luther King in the 60s. He was Dr. King's physician, when Martin Luther King lived in Illinois 50 years ago in 1966. And Quentin always believed that being a doctor was not only taking care of your individual patients, but also having a strong voice for decent health care in the society at large. So roughly, I guess 35 years ago or so, I asked him if he'd be my doctor, and so he said yes, and I went down to his office, and we had a relationship that went for more than a third of a century. And I did go, and he was an excellent doctor. He kept me alive, and I would have to say, when I arrived at his office after the physical checkup or whatever it might be, then he'd like to talk about how you put movements together to get decent health care. And we did a lot of things. We put referendums on the ballot. They were advisory referendums in not only in Cook County, but all over the state. We traveled across Illinois, and we believed in universal health care, so we put put together what we called the Bernardine Amendment. It was named after the Cardinal of Chicago, Joseph Cardinal Bernardine, who had passed away in 1996. He was a great man indeed. And before he became a priest, he had gone to the University of South Carolina and was a medical student. He was a pre-med student and always believed in the importance of health care, not only the access to health care, but making sure that everyone was in and no one was left out. And that was Quentin Young's famous saying, everybody in, nobody left out. But anyhow, just before he passed away, Cardinal Bernardine wrote a pastoral letter to really all of us, not only in Illinois, but across America, lamenting that in his lifetime, our country had not been able to get health coverage for everyone, decent health care. So we decided to put an amendment together and put it on the ballot across Illinois, encouraging that very fundamental right and privilege. That health care is not a privilege, it's a fundamental right. That was our view. And so we were very successful at that. We had on the ballot, we passed it everywhere, but we wanted to keep the movement going because we wanted to do something where the legislature of our state at least would take specific steps, tangible steps in law that would actually achieve this notable and laudable goal. So in 2001, in August, Dr. Young and I, he was 78 at the time, I was a little bit younger than that, but we went to the Mississippi River at the Centennial Bridge in Rock Island, Illinois, above the big river, and we decided to walk across our state, walk all the way from that bridge and that river to Lake Michigan in Chicago. It was 167 miles, and if you want to lose weight, I can tell you, this is what Quentin told me. He said, you can eat anything you want in this trip. So we were tromping. It took a couple weeks, really. We stopped along the way, quite a few stops, to talk about the issues we were concerned about. But 167 miles, every day was 90 degrees in August. It was quite, we met so many people, and, it was a very scenic. But it was definitely a rigorous walk, and we made it to Chicago and Lake Michigan, and we got quite a bit of publicity along the way. We met a lot of people, had many allies, and it was a very important mission in our state to, I think, let everybody know that we were serious, that we believed in this cause. And at the time, I was not in office. I had been state treasurer and had been elected to a local office. I'd done all these petition drives over the years. We did one. It was called the Citizen Utility Board to fight big utility companies. And I did that, I think it was 82 or 3. And we put it again on the ballot. Passed, the referendums passed. They were advising the legislature to have a consumer group for utility consumers. And the idea was to put these envelopes in utility bills and public mailings so people could join the group for $5 a year. You didn't have to join, but if you wanted to, you had this access. And so it was very successful. Club passed it into law, and people joined up. Thousands of people. It's still around today, 33 years later, and I think it shows with your association that when you start with acorns and small seeds, you can build big trees. Johnny Appleseed, by the way, who planted a lot of apple trees along the way, he went through Illinois. So if you see an apple tree, that might have been one of Johnny Appleseed's apple trees a long time ago. So I think it's important to understand that building an organization, there has to be people at the beginning who have a vision, who understand how to work together and organize, early to bed, early to rise, work like hell and organize. That's what it's all about. So, anyhow, in 2002, I ran for lieutenant governor in our state, and part of my platform was decent health care for everyone. This is before he was state senator, Barack Obama, and Barack Obama had been not a patient of Quentin Young, but he was a patient of one of the other doctors in the group that Quentin Young had. And so he knew Dr. Young, he knew me, and So I got elected as lieutenant governor. I spoke out about this issue, and lo and behold, as you know, Barack Obama then ran for U.S. Senate and won in 2004 in Illinois, and then not that long later, 4 years later, he became president, ran for president, and got elected. And there were those on his staff, I know them, who told him, don't touch this health care issue. It's just radioactive. It's a third rail, you do something else. I mean, obviously, you all know what we were in 2009. I got sworn in as governor 8 days after President Obama. I didn't exactly get elected governor. What happened in Illinois, I had been reelected lieutenant governor in 2006. And the governor we had, his name was Blagojevich. The lieutenant governor ran separately from the governor in the primary, so I really wasn't much of a political ally of him. But there I was, and there he was, and he got himself in quite a bit of difficulty, to say the least, and he got impeached and removed by a trial in the Senate in 2009. And so January 29th, 8 days after President Obama got sworn in, I got sworn in as governor of Illinois in the middle of a very difficult time for our country economically, as well as our state budget was greatly affected by the recession. And then we had this ethics crisis as well. So we had to do something. And the president at that time was being advised by some of his advisors not to touch health care. It was just too controversial. Do other things. We're in a crisis here in America. But he, as you know, his mother had died early in life, frankly. I think she was in her 50s, early 60s, from cancer. He felt the insurance companies were very difficult to deal with during his mother's battle against cancer. And the president, to his great credit, and his wife, Michelle, the First Lady, they believed in this cause. And I recently got a chance to be with the president, and when I saw him in March, he said, well, how's Quentin Young? And I told him I had seen Quentin. He's now living out in California, Berkeley, California. I've been there with my youngest son in summertime, and I said, well, he's slowing down, but he's still fired up, ready to go, And so the president said, well, I'm going to give him a call. Give me his phone number. I want to write him a letter, because he had been touched by this doctor, this educator really, about the importance of decent health care. And he did have a chance to talk to Quentin before he died. And President Obama was very committed to the Affordable Care Act. I want to say it's not perfect. It hasn't included everybody in America. I wish it did. And I think we need to build on it. But it really advanced health coverage in our state, in our country too. In Illinois, I heard the bio there, but we've added over 1 million people to health care coverage since that law passed. Now, we had to, in Illinois, in order to accept the Affordable Care Act from the national level, we had to pass a bill into law in our state legislature saying that we would accept 100% federal money for Medicaid expansion to include more people. And to also, if you know, in the Affordable Care Act, there are many provisions there about preventing bad things from happening, bad outcomes. And so it was very, very important that we do this. And I would say it wasn't a very easy task in our state legislature, which had a majority Democrat in both the House and Senate. We got it through the Senate pretty quickly, but as Kurt can tell you, in the House it was quite a battle. The Speaker of the House was not a big fan of Affordable Care Act and was slow to move. But we built a majority, and I think it's important to understand in your advocacy, oftentimes you may not win the first time, but you got to be persistent. You got to build a majority, and we did. And we put together legislators who supported the Affordable Care Act acceptance in Illinois, and it passed, and then I signed that bill at a University of Illinois hospital. We had a very large group of people who believe in decent health care, who understand the importance of prevention in particular, and we use that occasion to help educate people on this mission. And it is, as I mentioned earlier, a public health mission. And again, referring to Dr. Quentin Young, once upon a time in his life, he ran for president of the American Public Health Association. I went out there to Washington to his swearing in. And what is public health? You know, he would, whenever I'd visit him for a medical appointment, he would give me his aphorisms about the importance of public health. He said that in the last 100 years, the last century, the advances in American life expectancy, people living longer, my mother living to 98, my father lived to 93. Now, why is that? Well, there's a lot of reasons, but one of the most important reasons is public health measures, whether it's clean water, we know about that issue now, whether it's putting on your seatbelt so you don't die in a car accident, whether it's stopping smoking. All of these are public health measures, and that's exactly what you're doing with your education and teaching people how to deal with a chronic disease, diabetes or prediabetes. So it's very, very important to understand that you're part of this American movement of the past 100+ years of preventing bad things from happening by taking common sense steps. Now, when you say steps, after I walked across Illinois, and now I was lieutenant governor, we believed in fitness, but we don't believe in preaching to people too much. I don't think that works so well. So we always were looking for ways that people could learn about our decent healthcare message, learn about fitness, maybe deal with obesity in one way or another in a positive way. And so we started a program that began when I was lieutenant governor and continued when I was governor, that if you walked 167 miles in the course of a year, then you walked across Illinois, just like I did, just like Dr. Young did. And we would have a certificate that we would send to someone who, you know, kept track of their miles and then notified us by social media or any other kinds of notification. And we'd send them this certificate with their name on it from the lieutenant governor and then the governor that you walked across Illinois. We had a diagram of our state, and you know, it looked pretty good. People liked that. And so then we would have opportunities, events, oftentimes to get publicity about our walks across Illinois to encourage more people to sign up. You know, with the internet, you can get people to learn about it, sign up, and then keep track of their miles, and then off we go and send them the certification. But we would have gatherings where people got together, celebrated the fact that yes, they did in the course of 1 year walk 167 miles. Might have been a mile a day or half a mile a day, whatever the case might be. Now, some people were super walkers and they walked far more than 167 miles, but the idea of trying to get people, all people, to walk 167 miles in 1 year, that's pretty much of a commission, a great challenge to all of us. So we would go down to Navy Pier here in Chicago and have a gathering, invite all of those who had done that, and we would award them their certificates right then and there. I remember one day we had a little 6-year-old boy who had just done it. Thank you very much. And then somebody else was 92. You know, had done it. So everybody in, nobody left out when it came to walking. And when you really look at the great movements in our country, whether it's for civil rights or for peace or for consumers or for the environment or many, many other things, it's the walking people who are the heart and soul of the movement. And we should always kind of keep that in mind. Mahalia Jackson, who came from Chicago, great gospel singer, she passed away some years ago, but she always said she sang for free for the walking people. And on those steps in 1963 in Washington, D.C., when Dr. King was delivering his immortal speech on the steps of Lincoln Memorial, right near the end, he was delivering the speech, but there was this woman's voice. She was the only woman on the steps there, close by at least, and she said, "Tell them about the dream, Martin. Tell them about the dream." And that's where Dr. King kind of riffed into those words that all of us have heard many times and need to be inspired by. You know, you have to have dreams, you have to have visions. Where there is no vision, the people perish. That's from Proverbs in the Old Testament. So that's really what your association really has to think about. What are our visions? What are our dreams? As was mentioned, I signed a bill into law for a diabetes action plan in our state. We also, I think there's a day in particular we try to salute there in November to really wake everybody up about what the issue is, what people can do about it in their family, in their community. It just so happened that two legislators who had children with juvenile diabetes were very, very interested in the issue. One was the minority leader of the House. The other was an influential legislator. He's now the minority leader of the House. So even though they were Republicans and I was Democrat, we got together on this diabetes issue to talk about it. And their kids came, these young women who were in high school, who had to deal with diabetes every day. They were very inspirational. I was very impressed by their commitment, and I think that you got to find allies. And so I wanted to talk a little bit about that with Kurt. And last night I was visiting, and I said, people in politics, whoever they are, whatever party they are, whatever office they hold, they have, most of them, not me, but most of them, have little applause meters in their pockets or purses, okay? And so when they hear applause, they're very happy. They feel positive. And so that is a good thing to always keep in mind when interacting with those in not only federal office, congressmen and senators, but it's a lot more approachable, really, at the state level, your state representatives and state senators. And then don't forget, local office, whether it's county office or city office, you want to get allies, and flattery will get you everywhere, and so you don't want to be going there with clenched teeth, telling people what they need to hear, but you got to do it in a nice voice. So I think that's important. That's really what life is all about. You get a lot more when you work in a positive way. You can be firm and persistent, don't get me wrong, but I think it's very important to, when you have a champion or when you try to recruit a champion, sometimes a person's running for office and you want to talk to that person about the issue of diabetes education. And, you got to maybe come back a few times. And if they win, send them a note. Or an email, whatever the case might be. Even if they lose, send them a note. They believe that. But when somebody loses an election and they get a note from you saying, well, you got in the arena. That's what democracy is all about. Teddy Roosevelt said, it's those in the arena who make a difference, who aren't afraid to take on a challenge. And maybe that person who loses the election runs again and wins, or runs for a different office and wins. Well, they remember you, I guarantee you, because I used to do that. I used to call people or write notes, win or lose. I can tell you I had an agenda. Part of it is how do we get decent health care, better health care in Illinois. You have to be unceasing in your advocacy. And you have to be clever. You have to be always creative. I think it's important sometimes when you have different groups that are involved in the healthcare mission to band together, work together. Everybody has a role to play. So I think that's something to keep in mind. I mentioned last night when I was talking to Kurt that I really believe in passing state laws and such. But sometimes that state mission, you have to do something local to get local legislators to pay attention. So don't ever neglect doing something at a city level or a county level to get the ball rolling. This is what democracy is all about. I think it's not a spectator sport. Too often in modern America, people get a little discouraged and think democracy is something that they watch or it's something other people do. And so we really have to activate our citizenship and flex our citizen muscles and take the cause or issue or subject that we care about, that we want to make a difference on, make sure that we organize together to get that accomplished. You don't win every time, you don't win the first time, but I think it's very important to try, and it's amazing what people can do when they band together in a committed way. I also wanted to mention a program that we got going in Illinois that kind of deals with diet, and particularly for children, especially children who are of color, and oftentimes they are eligible for the school lunch program. We noticed that there was also a school breakfast program, federally funded 100%. But a lot of our school districts were not participating. Most of them participated in the school lunch program for children of a certain income level, but quite a few were not participating in the school breakfast program. So we wanted to get more school districts going on that. And again, when you have a better diet, when kids actually are eating breakfast, they learn better, and they also eat healthier. They're not eating junk food as much, and they're not maybe by lunchtime so hungry they're eating, potato chips and other things. But so I went to some schools, and there was one school in Berwyn, Illinois that was doing this very well, and we wanted to teach other school districts how to get involved. And so I went to an actual classroom where the kids were having breakfast, and it took 5 or 6 minutes, where the teacher distributed the breakfast that came, and the kids ate it at their desks, and then they started taking their lessons. And so in order to move that movement along, we had a conference at the governor's mansion where school district officials could come, and they could learn about breakfast in school, and then they can have breakfast at the governor's mansion. Most of them are pretty happy to be there. The governor's mansion in Illinois is third oldest in the country. Abraham Lincoln visited quite frequently. It's a very special house. And so that was it. We were able to recruit a lot of school districts that weren't in the fold yet and teach them about this program. And that's something to think about too. If you have a governor who's into the mission, diabetes education, you might encourage him or her to have a breakfast or a lunch at the governor's mansion, and get folks, perhaps legislators and others, to come and learn more and get involved more. So I think that's really important. There is one other thing I wanted to bring up, and I'll be glad to answer any questions people have. This is a little bit a field perhaps from your advocacy, but maybe not. Because when I was governor, if you recall, I think it was the summer of 2014, there was kind of a movement in our country where people would douse water, a bucket of water over their head. And it was really dreamed up by a fellow named Pat Quinn from Yonkers, New York. Yeah. Same name as me. He's a big baseball fan. Lou Gehrig had ALS. And so Pat Quinn decided to douse his head with water. He had ALS, and he was doing this to try and raise attention to ALS and also raise money, And so I found out about it, like millions of Americans, and I did it in Illinois. And then the idea was, then he said, well, why don't we just call this guy up? Maybe he'll come to Illinois. And he did. He and his brother got off the airplane over here, and we did it again. We did another bucket challenge. Well, we did it with a bunch of kids, and they all got doused. And then I challenged the best pitcher on the White Sox, Chris Sale, he's pitching tonight, as a matter of fact, to do it. And, it caught on. Now, that was how they did it. But, you always should think about, somebody out of the blue comes up with what might be an off-the-wall idea until it isn't. And that's how you create a movement. And it is about names and keeping in touch and using social media and having ideas and brainstorming that come together. It's never going to end, okay? There's no end point as far as advocating for decent health for everybody. But I think it really is something that everybody has a role to play, and we want everybody in and nobody left out. Thank you very much.